I wanted to make this video for Rebecca Ray. So this is on the topic of relines. So Rebecca is in the early stages of her immediate denture process. She has had her teeth extracted, she's gotten a soft reline, and she's in that time of frustration when she's like, my soft reline was amazing when I first got it, and now the dentures are loose again. And, she's having to use adhesive and some thermoplastic products to tighten that denture up and stabilize it so that she can function. This is a very common issue during healing. She's also, kind of exasperated and saying, so we're not supposed to use thermoplastic products and a bunch of adhesive long term. So what do we do? Are we supposed to just get relines forever for the rest of our lives? Yeah. So this is what, for whatever reason, providers are not telling their patients. And I don't know why this disconnect is there, but this is the process. So when you have your natural teeth, there's a root structure that extends down, not connected to the bone, but in the bone. And you have little connections to that root structure. It's called the periodontal ligament. When that tooth is extracted and pulled, then there's a hole. So that hole has to fill in. That bone has to remodel and deposit bone cells and fill that hole in. But because there isn't the root structure anymore, there's nothing to hold that bone at that position anymore. And so it closes and shrinks away. That process takes about 6 months for that to stabilize and calm down from that acute stage of healing. So during the first couple of months, it's very, very rapid. Okay, so what she's experiencing right now is rapid changes to her bone structure and her tissues that are healing. So that frustration of, she just got a reline, a soft reline to tighten them up, and they felt great for a minute, and now they're loose again. That's very common. And that is why, this is a denture journey that they describe when you are getting immediate dentures. It's a roller coaster. The dentures, usually loose to begin with because we have to, open it up a little bit to get over the curves of your gums. And so it's loose, and then you swell into it, and then your swelling goes down and it gets looser. And then, we tighten it up with a soft reline, and then it gets loose again. And then we tighten it up with a soft reline, and it gets loose again, but it's slowing down. In my practice, and I've done this for decades, my parents did it for decades, and this is what we have found to be the best approach for us and our patients is at 7 to 10 days out following extraction, I do a temporary soft reline to tighten that denture up. That's kind of the first breath of fresh air for the patient, tightens them up and stabilizes them. Then it gets loose again, but I'm very open about this process with my patients. At 4 to 6 weeks out, when things are kind of starting to settle down, I do that temporary soft reline again. Now, I don't do any more temporary soft relines because if I keep laying temporary soft relines in that denture, it will thicken the denture up so much, it will open that vertical dimension because the dentures are getting taller and taller with each of those layers of relining. So I only do two temporary soft relines. Then at 6 months, in almost all cases in my office, I do a permanent hard reline on that immediate denture, and that immediate denture is then converted to the patient's permanent denture that they can wear for several years. So in many offices, the providers will do it differently. They will do an immediate denture, and they'll call it your healing denture. And you will wear that denture for 6 months to a year. They'll do soft relines, and some providers will do numerous soft relines in there because they're really not that concerned with thickening up the denture too much, or maybe they're even taking the relines out. But they're really not that concerned with it because that is not going to be the long-term denture. That's just a healing denture for them, and you're going to get a different denture, a new permanent denture after that healing. I do things differently in almost all cases in my office, and I do it because I live in a town with primarily retired people who are living on fixed incomes. And my patients really cannot afford to buy 2 dentures, in the course of 6 months to a year. So this is just how my family has done it, and this is how many providers do it. So there's some different, different things that providers are doing, and that's probably why it causes a lot of confusion on this platform. Some people are getting on here and saying, I have one denture now and I'm going to heal in this, and then I'm getting another denture. Or then another person will come on here and say, well, my provider said that I'm not getting another denture and that this is my permanent. What's going on? Well, that's what's going on. So you really have to communicate with your provider, in the beginning, and ask these questions. And providers, you need to be telling your patients this ahead of time so they know what the expectations are. You need to know, is this going to be my permanent denture? Am I going to get a permanent hard reline at 6 months, or soon thereafter? Or am I going to get a whole new set of dentures? You need to be asking, are relines included? In my office, I include the temporary soft relines. So the 2 temporary soft relines, I include that in the cost of the immediate denture. Then at 6 months down the road, I charge a separate price for that permanent hard reline. And just to give you a general idea, because a lot of people on here just think, oh yeah, she charges all this money. I try to keep my prices very affordable. I charge $1,200 each for immediate dentures. I charge $400 each for permanent hard relines. And I don't charge for the soft relines. I don't charge for adjustments. If a patient comes to me and they've already had dentures for over 6 months and they want new dentures, I charge $950 each for those dentures. Those are my prices right now as of August 2025. So adjustments, those should be included in the immediate denture process. And I just think that anybody who's charging separately for adjustments that's ridiculous. But these are the questions you need to ask. But the main crux of this video is to say, yes, down the road, you will need more relines forever. Forever and ever, your gums are going to change until the day you die, because there isn't root structure anymore, in that bone for the bone to remodel around. So the lifetime of a denture should be 5 to 7 years. And that's not because they won't last longer than 5 to 7 years. It's because your bone structure is changing, the surfaces of the teeth are wearing down, and your vertical dimension is closing with that shrinkage of the bone and the wearing down of the teeth. Pretty soon, you're wearing dentures that are too short for your mouth, too worn down. Also, the acrylic gets brittle over time. But when you're over closing, your muscles, these muscles that connect from here down to your jaw and into your mouth and this area, those start to kind of get stretched out because you're working and working and working to use these dentures that are no longer fitting. They're shorter than they're supposed to be. Your bone structure has changed, and now you're stretching this muscle, these muscles out, and you are affecting your facial structure. So that is why it's so very important to get new dentures every 5 to 7 years, because you're reestablishing your vertical dimension and keeping the facial structure, or keeping your muscles in their normal, state. So 5 to 7 years. And I've been doing this for decades. And in my experience with my patients, usually within that 5 to 7 years, they are getting about 3 relines, 2 to 3. I don't like to do more than 3 relines, and preferably 2 permanent hard relines on dentures, because again, every time you put a reline in that denture, it's thickening up the denture each and every time. And I mean, I am very, very fastidious about putting that impression material in that denture very, very, very thin, so that it doesn't thicken the denture up more than just taking up a space where the bone has shrunk away. So that's something that providers really need to pay attention to when they're doing relines, and really something that the patients need to be paying attention to when their providers might not be paying attention to it. But I hope that helps. I know it's not the news that everybody wants to hear, but it doesn't take away the fact that it's a fact. That is the treatment modality. That is the science of the anatomy and the shrinking of the bone and the physiology of the muscle and facial structure. When you are using these gobs of adhesive, I talk about this all the time. You're filling up the denture, and the denture's moving around against your gum, and it's quickening that bone loss because of the mechanical wear of the denture moving against the tissues. The same thing with these thermoplastic products. They're soft enough to where it's still allowing that denture to rub against the bone and wear the bone down, and it is affecting the vertical dimension if too much is used. Okay, I'm running out of time. I hope that helps. If you have any more questions, drop them in the comments. Have a great day.